Hello, my name is Jessica Colazzo. I'm the Community Outreach Coordinator for Keystone Canna Remedies. April is Autism Awareness Month, and we thought it would be a great idea to have a conversation about medical marijuana and autism. In the state of Pennsylvania, autism is one of the 23 qualifying conditions. So I'm joined here by our Pharmacist and General Manager, Monica Werkheiser, and we have a special guest, Erica Daniels. She is the founder for Hope Grows for Autism. Erica, can you tell us a little bit about Hope Grows for Autism and how you got started?
Hi, thank you for having me, and thank you to Keystone Canna Remedies for always supporting the autism community. Hope Grows for Autism is a nonprofit, and our mission is to improve the lives of families affected by autism through research, education, and advocacy of natural treatments, including medical cannabis for autism. Hope Grows for Autism was founded by me in 2016. I am also the mother of a now 15-year-old son who has severe autism. He began using medical cannabis successfully almost 4 years ago. And through that process and really recognizing that there were so many stigmas and roadblocks along the way, I started reaching out to other families, and we developed a community. And in the beginning, we were sort of like an underground railroad of parents talking about medical cannabis, and now we've grown globally, really, and we're reaching families all over the world.
Yeah, that's awesome. It really is such a great organization, and the resources you have are just great for parents. So let's just get right into it. What is autism spectrum disorder, and why the use of the word spectrum?
So autism is spectrum disorder, is a neurodevelopmental disorder that often comes along with some or all of challenges in the following areas: language, social awareness, repetitive self-stimulatory behaviors, sensory processing issues, neurodevelopmental differences and learning challenges. And the reason why we call it a spectrum is because really anyone on the autism spectrum can fall anywhere. There's all very different. So we say people fall on a spectrum. And sometimes you'll hear words like high functioning or low functioning. Those can sometimes be off-putting to people with autism or their families. So you might want to think about it in a way of someone who might need high support needs on one end of the spectrum and low support needs on the other end of the spectrum. And anywhere in between there, you can find one person with autism that's going to be different from anyone else with autism on the spectrum.
Now, Monica, knowing autism is a spectrum disorder, how does that impact treatment?
It impacts it quite largely. Knowing that autism is a spectrum disorder, as Erica was saying, that you have all these different types. One of the things I love hearing Erica say is always that if you've met one child with autism, you've met one single child with autism. There is no child alike. And we see that every day here when dealing with the different families, trying to get support for their children. And it's trying to manage what are our primary goals. Are we looking in the spectrum of more cognitive function? Are we looking in social impairments? Are we looking at repetitive behaviors? So really kind of looking at those differences, because each child is going to be, some may be able to verbalize and communicate, but it's that social interaction that's the issue. Others can have a social interaction, but it's IQ and learning abilities, or for some it's going to be aggression and tantrums, and it's very different from patient to patient, which means that there is no one single therapy that's going to blanket every child. And that's one of the shortcomings that comes with traditional pharmacy, is that it's very black and white in traditional pharmacy, and you have one pill at one strength, and that is supposed to be the be all end all for every child. And unfortunately in autism, that is not how we need to approach it or treat.
So Erica, what are the symptoms that you find to be the most common with those with autism? I understand there are also comorbid conditions associated with autism. Can you speak on what those are?
Yeah, definitely. And like Monica was saying, there is no cure for autism. There is no pharmaceutical. So it's really important that families can explore, different kinds of treatments. And this question that you're bringing up now is even more important because individuals and children with autism tend to have a significant amount of comorbid medical conditions in addition to their maybe cognitive or behavioral challenges. So we know that they have endocannabinoid deficiencies. We know that they have inflammation, oxidative stress, gastrointestinal disorders, mitochondrial dysfunction, pain sometimes, and oftentimes that may overlap with depression, anxiety, ADD, OCD, ADHD, learning disabilities, and things like that. So it's really, again, back to the spectrum. It's really a very broad spectrum of symptoms and comorbid conditions. And typically when, parents are looking at any treatment, but particularly medical cannabis, I think it's important to narrow in on 2 or 3 of those top symptoms to start looking at a time.
So, Monica, as far as cannabis therapy, knowing that autism is a spectrum disorder where no individual is the same, along with these comorbid conditions that Erica mentioned, what does therapy look like and how do you measure success?
So, as Erica kind of mentioned, our first thing is really getting to know the patient, getting to understand the needs, and really narrowing down maybe a top 3 of their symptoms, because there can be numerous. So first we kind of help patients narrow down, is it stimming behaviors? Is it going to be eloping behaviors? Is this OCD? Are there comorbid conditions like seizures? Because that will factor in hugely from a patient who does have seizures to one who doesn't. So first, finding out what those top symptoms are is going to be largely a part of this. We may have a patient who is really, it's the social interactions, the social anxieties, those kind of factors. And so generally speaking, we'll stay with more THC dominance, knowing that it hits those types of parts in the brain that tend to guide and be more allowing for a person to be more open and engaging. Or potentially, like I said, a patient who is more OCD or tends to have those seizure disorders will start leaning into heavier CBD content to really protect that brain, to stop not only to help with autism, but also help protect the brain from all that seizure dysfunction and try to diminish some of those seizure potential. Looking at different things like different terpene profiles can have a very big impact. I have some patients who, with their gastric problems, they tend to do better with things that are higher with anti-inflammatory terpenes because it starts to bring down the gut inflammation. Or I have patients who, some autism patients who suffer from a suicidal depression. And so we'll look at different terpenes that can help with that depressive side of things too. A lot of big factors too come into age. It's looking at what's out there and what age range we have. I have patients with autism who are as young as 2 years old, and I have some who are as old as 40 years old. And I'm going to approach a treatment for them very differently based off what they can tolerate, what they can ingest, and just kind of looking at those different things as well. So it's not just looking at the symptoms, but also looking at the patient as a whole. And as they grow, their body changes, their mind changes. And so we have to be able to adjust the different levels of cannabinoids, whether it's THC, CBD. In a few other states, they're really looking into CBG content, or if it's looking into different terpene profiles to take care of some of those comorbidities that we've been discussing. So really it is tailoring it to that specific need of the patient, but then also their capabilities. I have a few patients who, when dosing, we can't look at just, okay, we have a child with a tincture. There's a lot of our kids, and this doesn't mean just autistic kids. There's a lot of kids who just don't like the flavor of medicine. So ways to get them to take a medicine of, can we encapsulate it, even if they don't make a capsule like that? Parents have started getting into, can I make a gummy bear for my child? Since those aren't available in Pennsylvania, we do have to get a little creative in the way that we are able to get these different patient populations to be able to ingest medication as they need it.
So because there's a limited amount of forms that are available in the state of Pennsylvania, like you mentioned with the gummies, Are there products out there specific for autism?
There are, and I don't like to say specific for autism because even products that have been created actually have broader categories. So Erica and Hope Grows have really kind of been on the forefront of this. They brought forward the Hope tinctures, and they were geared towards kind of looking at different ends of the spectrum. And Erica, I believe you would even mention that this is just a starting point with these Hope tinctures, that, you know, there's going to be more involved with them and more products coming out, but really looking at these comorbid conditions as well with them. You want to kind of talk a little bit about those Hope tinctures?
Sure, sure. So after starting Hope Grows and really starting to educate people and facilitate research, what I realized was that I can educate till I'm blue in the face, but if there's no appropriate products available in the dispensaries for this population, then it really doesn't mean that much. And, you know, in the beginning, when Pennsylvania first opened their program up, I heard stories about families coming home with vape pens and RSOs, and that was really, you know, that might be appropriate in some cases for sure, but I felt really strongly that it was really important to create a range of products that would be a starting point or a safe starting point for someone who had symptoms associated with autism. And that's where the Hope range of products came from. I was lucky enough to find a grower in Pennsylvania who was very research and medical minded in terms of the products that they were putting out. So we developed together the Hope line, and right now there's 2 products in the Hope line, but Hope 1, which is a 1-to-1 tincture, and Hope 2, which is a 5-to-1 tincture, and we talk THC before CBD in this line. And I thought it was really important to have other things included that are important to the autism community. For example, you know, gluten-free, dairy-free, nut-free. My son has anaphylactic nut allergies. It's made with an organic olive oil, carrier oil, and certain details like that tend to meet the expectations of the autism community. And what we were able to do is take survey data about people actually using the products, and there'll be a white paper coming out soon, which will be really awesome to share with all the medical professionals. But it pretty much reiterates what sort of we knew when going into it. If we take the information and data from the autism community, so for example, flavoring, you were talking about flavoring. So we literally invited at Hope Grows a bunch of members and family members and individuals with autism to taste different flavors, unmedicated of course, but to see what they liked. And what turned out was really interesting. We ended up with a mint chocolate flavor for Hope 1 and a grapefruit for Hope 2, which a lot of the people that were working on the product or worked in the dispensary didn't choose those flavors, but the autism community chose those flavors. So that's why we went with that. So really the Hope range of products was created with autism in mind and in a launch, learn, and develop strategy. And right now it's available in Pennsylvania, and soon it'll also be available in Louisiana and other states across the US, as well as Australia and Germany and other parts of Europe.
Yeah, that's really exciting. And for anybody keeping up on the news, what Erica was mentioning and being in different states, there is a medical company out there, Zalira, I believe it is, and they will actually,
therapeutics, yes.
They will be producing a first clinical trial including these products, so we can really get some knowledge. One of the things I think we see that's lacking out there are studies looking at cannabis and autistic patients. And a lot of the studies that we see focus solely on CBD content. And not that that is anything wrong with that. There's definitely a lot of science behind it. But in the field, in practice, and I'm sure as Erica can speak to some of her patients, we've noticed that THC, CBG, all these other compounds in the marijuana plant play a bigger role. And utilizing that as a whole, we tend to get better results in seeing these different factors, why those hope tinctures contain not just THC and CBD, but this other plethora of terpene content to really give this full spectrum treatment rather than just looking at one bit and piece, trying to really piece in all those other things that are going on for these patients.
Yeah, and just to add to that, um, what we hope to accomplish with the hope tinctures is to really develop enough products so that we can meet the needs of these certain clusters of autism symptoms that we're seeing together. So I think it's important what you're saying about THC. Everybody wants to talk about CBD because they feel more comfortable about it or it feels safer. But the truth of the matter is that a lot of times patients with autism do worse when you just use CBD, and particularly over-the-counter kinds of CBDs. Our community and our Hope Grows community really tends to use THC products, like very consistently.
Yeah, that's great. So the state of Pennsylvania, it's one of a handful of states where autism is a qualifying condition for medical marijuana. What must a person with autism or their caregivers be aware of in order to obtain a medical marijuana recommendation in order to get access to this type of medication? Monica, could you speak on that?
Yeah, yes, of course. So, firstly, to get access, sometimes that can be a challenge just depending on the state. I know in our state, some of the issues just become technical. I mean, I for how many times people have tried to sign up for the program online and the issues around that. So first it becomes the technical, and then it partially becomes the financial. Looking at things, because this is out of pocket as it stands in the US government. This is still federally legal and not recognized as a medication. So this is out of pocket, and financially that can be a burden. And we see that twofold, whether that's in the medical cannabis field or even, as Eric had mentioned, those using those online CBD products, you're utilizing very large amounts of CBD. And that tends to be a little bit pricier. So those tend to be some of the shortcomings and falls of a program. But what I notice, programs like Hope Grows, offering support for families. We do partner with people to try to offer what we can individually. So there are things that can help patients to support and get through and help support their children. The other thing is that can be difficult is getting integrated care. In Pennsylvania, we're lucky enough to have medical professionals involved in the cannabis field, so we can really try to keep conversations between dispensary pharmacists, their primary care physicians, their neurologists, their therapists, all different types of medical professionals being able to communicate and have a really integrated care rather than being its own separate entity. In states where they don't have medical professionals, it does become a challenge because unfortunately now you are in the Wild West. You are on your own you're left to your own devices to figure this out by yourself. So those do become challenges. Other things I see become more personal. And Erica, you probably can speak to this more, of difficulties with school districts allowing, can we dose in a school day or can't we? What does it become in the legal system when, even in family court, if a parent is going through divorce or already divorced and you have multiple caretakers for one child? In the state of Pennsylvania currently, as a patient, you can only have 2 caregivers assigned. So if you have a mother, a father, a grandparent on each side, you can't have all of them coming in to help and learn and educate in the system. So, I mean, Erica, you can speak a little bit more to this.
Yeah, there are still quite a few challenges. And I think what I've noticed during COVID-19 in this area in particular, and, removing some of that red tape really is helpful. And I'm hoping that that will continue. So now we're able to do phone recommendations, phone doctor visits and things like that. That has been a huge burden removed from these parents who are trying to get their child out of their, 10 different therapies going on. And typically it's a doctor that they don't know. Most of our big hospitals and our pediatricians are not recommending. They're somewhat knowledgeable or they know about it, but they don't know enough to tell their patients or their patients' parents, kind of what to do or who to see. So I'm pleased with the progress, you know, we've had in Pennsylvania. In the beginning, I couldn't even find anyone to give my son a recommendation. And now there's definitely quite a few doctors and professionals that I refer patients to all the time. So we're lucky in that way. The other thing is I never wanted anyone to not be able to afford medicine. I always felt really strongly about this. So Hope Grows does have a patient assistance program to help families that need help with their doctor's appointments or medications or, you know, whatever that may be. So we do that, and we offer that help and support, as well as a private online caregiver group where you can, you know, families really can lean on one another, ask all the questions that they want to ask and not feel judged, and have, you know, 10 other parents that sort of have that same question or have been in that situation. So yeah, there are a lot of challenges, and we're trying at Hope Grows to help families with those challenges. But the best thing that we can do is get some really more good research coming out. We do have some already. We had the Tikkun Olam study that came out, which was very positive. We have the Children's Hospital of Philadelphia study that's in progress, so hopefully we'll see those results soon. And you know, at Hope Grows, we take data. We do surveys all the time because that's how we can find out really what families need, want, and how to help them.
Yeah, I think that's really great what you guys do there, Erica. It's always a key point. I try to tell families that yes, you have your support system at home, you have your support system within the dispensary. That's why we're here, but you should also have a community, and something like Hope Grows is a great place to have that community, because comparing notes, you know, there are all different scenarios. No child is alike. So remembering that when you're talking to people, that's just something didn't work for one child may still work for you, but let's see where better starting points are, or better, you know, things thinking outside the box. You know, we had a patient who is too young but knows how to use an inhaler. And so in talks with different families, different patients, we realize that there's a PAX product out there that you can set microdosing. So no matter how hard this child pulls on this device, it still stops at the dose that works for them. And so just getting these creative ideas from different families and all of us working together is really what's going to progress us, and really what's going to get the information we need to be able to help more and more families.
Yeah, and it's really been a complete grassroots effort, and you guys at KCR have been there since the beginning, working alongside us and our families. So we really appreciate that very much. And thank you so much for doing this and for always wanting to get the word out and educate and support families with autism. We really appreciate that.
Of course. Well, that's all the time that we have for today. For more information on Hope Grows for Autism and those resources Erica and Monica have both mentioned, you can visit hopegrowsforautism.org. Thank you again, Monica and Erica, for helping to spread awareness and autism, and hope everyone stays safe. Thank you.
Jessica.
Thanks, guys. Stay safe.